Most people think high blood sugar always causes a clear warning. They expect to feel very sick, become dizzy, or suddenly collapse. But that is often not what happens. Blood sugar can rise slowly, and the signs may be so mild that you blame them on age, stress, poor sleep, or simply having a busy day. This is especially important after the age of 50. Your body may become less sensitive to insulin as you get older. Insulin is the hormone that helps move sugar from your blood into your cells, where it can be used for energy. When insulin does not work as well as it should, too much sugar can remain in your bloodstream. Over time, high blood sugar can damage the eyes, kidneys, nerves, heart, and blood vessels. Yet many people with type 2 diabetes have no obvious symptoms at first. That is why knowing the possible warning signs matters, and why a blood test is the only reliable way to know what your blood sugar is doing. In this video, I will explain 6 signs that may appear when your blood sugar is too high. Stay until the end, because the final sign is one people often dismiss as a normal part of getting older. I will also tell you when high blood sugar may be an emergency and what simple steps you can take next. I am Dr. Adrian Mercer. This video is for general education. It cannot diagnose you, and it does not replace advice from your own healthcare professional. Number 6. Cuts that heal slowly, or infections that keep returning. Think about the last small cut, scrape, or blister you had. Did it take much longer than expected to close? Have you noticed a sore on your foot that seems to stay the same for days or weeks? Do skin infections, urine infections, or yeast infections keep coming back? These problems can sometimes be connected to high blood sugar. When too much sugar remains in the blood for a long time, it can affect circulation. Good circulation carries oxygen, nutrients, and infection-fighting cells to damaged tissue. If the blood supply is not working well, a wound may take longer to repair. High blood sugar can also weaken parts of the immune system. This may make it harder for your body to fight germs. At the same time, some germs grow more easily when more sugar is available. The result can be infections that happen more often or take longer to clear. The feet need special attention. High blood sugar can damage nerves, which may reduce feeling in the toes and feet. A person may step on something sharp, develop a blister, or rub the skin inside a shoe without noticing it. If circulation is also poor, that small injury can become a serious wound. Look at your feet every day if you have diabetes or have been told that your blood sugar is high. Check the soles, between the toes, and around the nails. Look for redness, swelling, cracks, blisters, cuts, or areas that feel warmer than the surrounding skin. A mirror can help you see the bottom of your feet. Do not try to treat a deep or infected wound by yourself. Speak to a healthcare professional if a cut is not improving, if redness is spreading, if pus appears, or if you develop fever. One slow healing cut does not prove that you have high blood sugar. Poor circulation, certain medicines, smoking, and other health problems can also delay healing. But a wound that refuses to heal deserves attention. Number 5. Losing weight without trying. Many people connect high blood sugar with weight gain, so unexpected weight loss may seem confusing. But it can happen when the body cannot use glucose properly. Glucose is one of the body's main sources of energy. After you eat, food is broken down and glucose enters the blood. Insulin helps that glucose move into your cells. If there is not enough insulin, or if the body cannot use insulin properly, the glucose stays in the bloodstream instead of reaching the cells. Your cells may then behave as if they are not getting enough fuel. The body begins looking for another energy source. It may start breaking down stored fat and muscle. As this continues, your weight can fall even though you have not changed your diet or activity. Some people also feel unusually hungry. They may eat a full meal and still feel that their body is asking for more food. This happens because the energy in the bloodstream is not being used properly inside the cells. Weight can also drop because frequent urination causes the body to lose water. This may make the change on the scale appear even faster. Unexpected weight loss should always be discussed with a healthcare professional. There are many possible causes, including thyroid problems, digestive conditions, infections, medication effects, depression, and cancer. High blood sugar is only one possibility. Pay attention if your clothes become loose, your belt needs a new hole, or family members notice a change before you do. Do not celebrate unexplained weight loss without finding out why it is happening. A simple medical review and blood test can help identify the cause. Number 4. Feeling tired even after resting. Everyone feels tired sometimes. A poor night of sleep, a stressful week, or too much activity can leave anyone low on energy. But tiredness, linked with high blood sugar, may feel different. It can remain after a full night of sleep. Normal tasks may feel harder. You may wake up tired, struggle through the afternoon, or feel that your strength has disappeared. This can happen because glucose is not moving into your cells efficiently. There may be plenty of sugar in the blood, but the cells cannot use it properly for energy. It is a little like having food locked inside a cupboard when you cannot find the key. Frequent urination can make the tiredness worse. If you keep waking during the night to use the bathroom, your sleep becomes broken. Losing too much fluid may also cause dehydration, which can leave you weak, slow, or headachy. High blood sugar may also cause changes in mood and concentration. You may feel irritable, find it difficult to focus, or struggle to remember simple things. These symptoms are not always dramatic, but they can affect your daily life. Tiredness alone does not mean that you have diabetes. Low iron, thyroid problems, sleep apnea, heart disease, kidney disease, depression, infections, and many medicines can cause similar feelings. The important question is whether the tiredness is new, persistent, or happening alongside other signs in this video. Do not try to fight constant tiredness with sugary drinks. They may provide a short burst of energy, but they can push blood sugar even higher. If you are tired for several weeks without a clear reason, arrange a health check. Number 3, blurry or changing vision. Have you noticed that words sometimes look unclear, even with your usual glasses? Does your vision seem sharp on one day and blurry on another? Do you find it harder to focus after meals? When blood sugar rises, it can change the movement of fluid in the tissues of the eye. This can temporarily affect the lens, which helps your eye focus. As the shape and fluid balance change, your eyesight may become blurry. This does not always mean that permanent damage has occurred. Vision can improve when blood sugar returns to a safer and more stable range. However, blood sugar that stays high for a long time can damage the tiny blood vessels in the back of the eye. This is called diabetic retinopathy, and it can threaten vision if it is not found and treated. Do not keep buying stronger reading glasses without asking why your vision is changing. An eye test can check more than the strength of your lenses. It can also look for signs of damage inside the eye. If you already have diabetes, attend the eye examinations recommended by your healthcare team, even when your vision seems normal. Early eye damage may not cause symptoms. Finding it early gives you the best chance of protecting your sight. Sudden loss of vision, a dark curtain across your sight, new flashing lights, or a large number of new floating spots needs urgent medical attention. Do not wait for a routine appointment if the change is sudden or severe. Blurry vision can have many causes, including dry eyes, cataracts, glaucoma, migraine, medication effects, and simple changes in eyesight. But if blurry vision appears with thirst, frequent urination, tiredness, or unexplained weight loss, ask for a blood sugar test. Number 2, feeling extremely thirsty or having a very dry mouth. Thirst is normal after exercise, during hot weather, or after eating salty food. But thirst caused by high blood sugar can feel difficult to satisfy. You may drink a full glass of water and want another one soon afterward. You may carry a bottle everywhere, wake during the night for a drink, or notice that your mouth feels dry and sticky. Here is why this happens. When there is too much glucose in the blood, the kidneys try to remove some of it through urine. Water follows the glucose out of the body. As you lose more fluid, your brain receives a signal that you need to drink. This can create a repeating cycle. High blood sugar makes you urinate more. Urinating more makes you lose water. Losing water makes you thirsty. You drink more, but if the blood sugar remains high, the cycle continues. Some people respond by drinking fruit juice, sweet tea, regular soft drinks, or energy drinks. These may make the problem worse because they add more sugar to the bloodstream. Water is usually the better choice for replacing fluid, unless your healthcare professional has told you to limit how much you drink. Do not assume that severe thirst is always caused by diabetes. Hot weather, fever, vomiting, diarrhea, certain medicines, kidney problems, and other conditions can also cause dehydration. The clue is a thirst that is new, persistent, and difficult to satisfy, especially when it appears with frequent urination. If your mouth stays dry, check whether you are also developing cracked lips, a sore tongue, bad breath, or difficulty swallowing dry foods. Speak to a healthcare professional or dentist because dry mouth can also damage the teeth and gums. Number 1. Urinating more often, especially during the night. Many older adults wake once during the night to use the bathroom. That can happen for several reasons, including an enlarged prostate, bladder problems, water tablets, evening drinks, or sleep problems. But a clear increase in urination can also be one of the most common signs of high blood sugar. Your kidneys normally filter the blood and return useful substances to the body. When there is more glucose than the kidneys can handle, some glucose passes into the urine. That glucose pulls water with it, so the bladder fills more quickly. You may notice that you are passing larger amounts of urine, not just feeling the urge. You may need the bathroom every hour or two. You may begin waking several times during the night when you previously slept until morning. Long journeys may become difficult because you need frequent stops. Nighttime urination can also explain other problems. Repeated trips to the bathroom break your sleep and cause daytime tiredness. Losing fluid increases thirst and dry mouth. Older adults may also face a greater risk of falling while walking to the bathroom in the dark. Pay attention to changes from your own normal pattern. The number of bathroom visits is less important than a noticeable and persistent change. Also notice whether the urine amount has increased and whether you are much thirstier than before. Pain or burning during urination, fever, lower abdominal pain, or blood in the urine may suggest an infection or another urinary problem. Those symptoms also need medical attention. Remember that none of these 6 signs can diagnose high blood sugar. Some people have several symptoms, others have none. The only dependable way to know is to have your blood tested. A healthcare professional may use a fasting blood glucose test, an A1C test, or another appropriate test. The A1C test gives an estimate of your average blood sugar over roughly the previous 2 to 3 months. Your doctor will interpret the result alongside your symptoms, medicines, medical history, and other test results. Do not diagnose yourself from a single home meter reading. Home meters are useful for people who have been taught how and when to use them, but readings can be affected by dirty hands, damaged strips, poor storage, or testing technique. If you have an unexpected result, follow the instructions from your healthcare team. If you already have diabetes and your readings are often above the target set for you, contact your healthcare team. Do not double your medicine, skip meals, or change your insulin dose unless you are following a plan they have given you. There are also times when you should seek urgent help. Very high blood sugar can lead to a dangerous condition. Warning signs include vomiting, stomach pain, fast or difficult breathing, fruity-smelling breath, severe weakness, confusion, unusual sleepiness, fainting, or high ketone readings. If these happen, especially in someone with diabetes, get emergency medical help immediately. So what should you do after watching this video? First, think about whether you have noticed a real change in thirst, urination, vision, energy, weight, healing, or infections. Second, write the changes down. Include when they started and how often they happen. This makes it easier to explain them during an appointment. Third, arrange a blood sugar check if the symptoms are persistent or if you are at higher risk. Risk can be increased by family history, excess weight, low physical activity, a history of diabetes during pregnancy, or getting older. Fourth, continue taking prescribed medicines exactly as directed. Do not replace medical treatment with herbs, supplements, or advice from an online video. Fifth, begin with safe daily habits. Choose water instead of sugary drinks. Eat regular balanced meals. Include vegetables, protein, and foods with fiber. Move your body in a way that is safe for you. Get enough sleep. These steps support health, but they do not replace testing or treatment. Let us quickly review the 6 signs. Number 6 was cuts that heal slowly or infections that keep returning. Number 5 was losing weight without trying. Number 4 was unusual and persistent tiredness. Number 3 was blurry or changing vision. Number 2 was strong thirst or a very dry mouth. And number 1 was urinating more often, especially during the night. Having one of these signs does not automatically mean that your blood sugar is high. But a pattern of symptoms should not be ignored. A simple conversation and the right blood test can provide answers. If you found this explanation helpful, subscribe for more clear and practical health videos from Dr. Adrian Mercer. Share this video with someone who has been feeling unusually thirsty, tired, or worried about their blood sugar. Take care of yourself, pay attention to changes in your body, and speak to a qualified healthcare professional when something does not feel right. Thank you for watching, and I will see you in the next video.